Expressive and creative art therapy is an approach that can be used in a therapeutic setting with children and adolescents. Often, children find it hard to open up with a therapist in the first few sessions. But once we bring in play and art therapy activities, they find it more beneficial to start opening up, to start engaging with a therapist and building that relationship with the therapist. On the other hand, for the therapist, when play is used with children, it's an opportunity for them to see how the children are able to focus on the task, are they able to patiently wait for their turn, to also notice how they take losses in a game. And that is an opportunity for children to then talk about how they feel when they lose a game and come up with a few coping tools together that they can use later on when they find themselves in a similar situation. And similarly, when we use art therapy activities, the children are encouraged to pick up colors that might match the way they think and they feel, and they're encouraged to put it down into paper. Often they're encouraged to make mistakes, to be messy, because that can be therapeutic in its own way. Once the drawing is made, the therapist and the child can then talk about what the drawing meant for the child, what are some of the feelings that comes up for them when they look at the drawing, and then help process that information that they're sharing. That can then help them to come up with certain tools, how they can manage these problems that they have spoken about through the drawing that they've made. So expressive and creative art therapy can be a very powerful approach for the therapist and for the child to build rapport, to identify the different needs, to process their experiences, and also come up with strategies and coping tools.